we were looking at how analyzing the ECG with deep learning can improve our diagnosis of cardiac dysfunction or cardiomyopathy. So I started working with this group before I started taking the classes, and a lot of the terms were not familiar to me. I understood the clinical aspect of it, but the AI part of it was a little bit challenging. So the standard of care to identify cardiac dysfunction is to get a cardiac ultrasound, and this takes time. It's an expensive procedure. It needs to be read by a cardiologist to interpret it. It requires a skilled person to actually perform or acquire the images. And we were wondering if there was a simple way to leverage this neural network to give us that answer, or at least identify higher risk patients for cardiac dysfunction. Even though I have a master's degree in public health and I have a medical degree, this really isn't sufficient to work in that space. So I really just looked up resources online. Where can I get the right education, and where can I learn more about how do I apply AI tools in healthcare? And I found MIT. That class provided a really broad overview of AI deployment from like a leadership standpoint, which I felt like was more applicable to me, since I don't think that I'll be spending a majority of my time doing the actual core programming. And all the people I worked with in my group were from like different parts of the world, which was amazing, like highly intelligent professionals in their field. And I got to learn different things from each person. We evaluated patients who came into the emergency room, about 1,800 patients, and this neural network did a really good job of identifying who had cardiac dysfunction. And I feel more comfortable now talking about the studies. I feel like I'm able to better explain the research to my clinical colleagues. And now people reach out to me to say, okay, I want to work on this project. Can I use AI to answer this question? My hope for AI is that we can use this to improve health equity. And health equity is like this broad statement, but there's so many things that are involved. So access to care is always an issue, right? So can we leverage digital tools and AI to make sure that people have access to the right physicians, the right doctors? I would say that the MIT program is like the perfect avenue for you to learn more about machine learning and AI, if that is what you want to learn. The program is also flexible enough for you to kind of pick and choose what you want to learn, like the areas that you want to spend more time in, or if you want more of an overview and less of, should I say, the programming and mathematical aspects of like AI and deep learning there. And it does cater to a broad range of professionals. So I loved it. So I would say if you're considering it, you should take it.